Thank you for the welcome, Kathy. I'm going to stand a little bit out here because I'm short and I hate standing behind a lectern. I am going to talk to you about lived experience-led innovation and particularly thinking about lived experience-led service models and thinking about the role of them as alternatives in the current system. Mine's had a really long legacy of lived experience leadership and work, and when we've thought about that work, we've thought about how do we really progress the conversation and come up with contemporary and sophisticated solutions. I really want to acknowledge the legacy of the people who have worked at Mind in this space before me, as well as across the consumer movement and family and carer movement. That work over many decades has driven us forward to a place where we're having these kinds of conversations in these kinds of spaces. When I present, in many ways, I find it really challenging to stand up and present. And so one of the things that I do to try and ground me and make sure I'm here as myself rather than as a position or any other kind of way of understanding my role in this space, I talk a little bit about my lived experience. And for a long time, I've done that by sharing some photos. And I haven't shared these photos before in a public space, but these are photos from about 2011, so I'm in Nepal. And the background to me being just at the very bottom of the Himalayas there is that for about 6 or 7 years prior to this moment, I'd had really significant mental health challenges for a range of reasons that had made life very, very difficult before that period of time. Just before I went and did this trip, I had another kind of series of life crises that made me pause and go, like, enough. I have to go and do something different here. So I packed my bags and set off out into the world for 8 months, travelling across Africa, Nepal, India, and spent time in southern Thailand working with Burmese refugees. I spent time in Buddhist retreat centres. I spent time in ashrams. I was trying to work some stuff out. This particular moment was about halfway through the trip, and I decided to go on a 6-day trek up into the Himalayas. I had a guide with me and myself, and that was it. I had a deep, crippling fear of heights, and I had a very deep fear of being in my own company and that I'd be able to keep myself safe. So I went to the Himalayas on a solitary trek. So this is me sort of at the start of it all, kind of grimacing. And as I went through that 6 days, it was monsoon season and there weren't a lot of people around. And my guide was a Nepali guy who kind of knew everyone in the villages. So he would just go and hang out with the villagers at night. So at night time, I was alone, often completely alone in guest houses up in these mountains. I experienced the most profound, I guess, experiences. I sat through one of the loudest and most terrifying thunderstorms that you can ever imagine, alone, with my thoughts, with my feeling, with my experiences. I spent, I came through that night and through a few others, and I guess what it did for me was it started to give me a space to move beyond the what or the how of my mental health experiences and into the why. I'm really trying to understand my story and what had brought me to this point and how I could move through. I don't necessarily recommend this approach in doing that, but what it did do for me was light a little spark inside of me that said, maybe there's a reason why, maybe I can trust myself, and maybe I can kind of live through this. And that was profound. When I talk about and I think about lived experience-led services, the reason I'm so passionate in this work is because I think we all deserve the opportunity to explore and understand the why. And I think we deserve the opportunity to understand the why in spaces that are safe, that are connected, and create space and time for us to trust ourselves and find a way through. So I'm going to talk a little bit about lived experience-led services now, but I just wanted to hold that context so I'm really present with how I come to this work. So we do have lots of evidence for lived experience-led services, but certainly not enough. And some of the things we know about lived experience-led models is they ground us in human rights. They help us to think about innovation and improvement, workforce culture, There are some business benefits, return on investment, that can be really helpful for us here too. But we need more evidence to really understand how to do these well, and I'll talk a bit about what that looks like as we go through. But first, I also want to outline the need for lived experience-led services. Not just about me and my story. There's a range of stories out there, and there have been for decades, about why we need lived experience-led services. These are some quotes that come from a project I'll talk about shortly about the need. I've been to hospital 10 times and never received care or referral, just rejection. We don't have services aimed at recovery and connection. It's all about crisis containment. There's a lack of services run by people with lived experience. There's no place I feel understood by the people treating me. Ultimately, we want a space to go that doesn't have a fear-based response. So at Mind, we have a few lived experience-led models. We have a queer and peer aftercare suicide program. We have a program called Connect SA that's about providing an alternative to going to ED. We're developing a project called The Healing Place, which will be Victoria's first lived experience residential service. So it'll be fully led and delivered by people with lived experience, and I'll talk a bit more about that project. And I'll also talk a bit more about mental health and wellbeing Connect centres. There are 8 mental health and wellbeing Connect centres in Victoria out of the Royal Commission. They're family and carer-led centres. We run 2 of them. They're fully staffed by family and carer lived experience workers. From our experience in developing and delivering these services, we know we have some unique challenges in how we progress this work, and we need some really proactive responses to help us work through those and drive this way of thinking and way of delivery forward. The types of challenges we've noticed, what we call the clinical ceiling. So we see within the lived experience-led services we develop and deliver, but also across the world, that when you deliver them in mainstream environments, you inevitably hit a clinical ceiling, which is when you defer to clinical governance. And clinical governance is not set up for lived experience-led models in the way that is currently delivered. It's largely based around risk and safety through a different lens than lived experience thinking offers. When I talk about the clinical ceiling, this is not to have a go at clinicians at all. It's more about how do we collaboratively find solutions that support us to hold different ways of doing that can actually genuinely offer alternatives within the system. The other one is the status quo. This is very hard to move in our mental health systems. Mental health systems were developed to contain. That's quite hard to shift. So there's a lot of myths and realities in the systems that we work within that make it very, very difficult to change things. So we have to really think creatively about how we do that. Part of that is because of this, fear. A reality of doing differently, a reality of trying to challenge ways of doing, a reality of stepping out of the status quo, a reality of pushing against systems of power, is it evokes fear. Lived experience work, when done in a nice, lovey feeling way, is good, but it should prompt discomfort and challenge in all of us working in the space, because that is what system reform and transformation is about. So I'm going to touch a little bit on what we're doing to respond to these challenges and start from the place of designing with those most impacted. And I'll talk a little bit about the Healing Place and the Connect centres to do that. So within the Healing Place, there's a few key aspects that we've centred to help us drive this work forward. One is intersectional design. Too often marginalised communities are not part of the conversation, and the services simply do not meet their needs. It is not enough to talk about being culturally safe. We have to integrate intersectional thinking from the very start and challenge the way that we move through design to be responsive to that. This is something we've done within the Healing Place design sessions. Service use and lived experience. The reality is we need to understand those most impacted, not just lived experience, those most impacted. Within the Healing Place design work, we've talked to people who have experienced harm within the current system, who have felt locked out of the current system, and who have actively been seeking alternatives. Through a series of 4 half-day workshops, we worked with this group to design a whole service journey from entry in through the experience and entry out, thinking about the mindsets that they needed and we needed to operate in. What came out was not in many ways anything that other than what is logical. Connection, agency, seeing people like yourself reflected in the service, connection to country, connection to culture, opportunities for doing differently, receiving information in the way that you need it, not in the way that best meets the needs of the service, and creating spaces of heart and love and connection. We asked them to imagine what this service might look and feel like, and these are some of the things that we heard. A place where I'm allowed to express distress and work through trauma and pain. A place where I can feel safe to speak and that is not going to be used against me when I become distressed or where the hospital decides to take away my rights. A place where showing my pain and trauma is not used against me, but instead is seen as strength and me taking a positive step to working towards building myself back up. A place where I feel understood and have a voice. You showed me how I can be more of myself. I understand how to hold more parts of me. I think that's what it was like meeting the peer workers, witnessing and connecting to someone I could feel in my bones, knew what it's like to go through what I've gone through. So this wasn't actually what they've experienced in the service, but what they wanted to experience in the service. And it's very, very clear what we need to focus on if we're to deliver this. The other example is the Connect centres, the family and carer-led centres. Similarly, we heard same kinds of things. So we heard, I want spaces where I can relax, where I can feel safe, where I can let go, where I'm not being treated like a problem, where I can spend time, where I am actively listened to. I want to be spoken to like I'm not a problem and there's a curiosity about how to help me. And I want the ways of understanding what my experience is to be held with respect and partnership. I heard, I noticed, I did, we talked about our plan. That's the kind of thing that would come through in the case notes. From doing all of this work, what we became really aware of was we could design these little services, and we have in some cases with existing services, and talk about all of this, but the system won't hold it. And then there is inevitable tensions and policies and practices and leadership and governance that arise. So what we've done with that is tried to offer solutions that talk not just about the problems of the current system, but provide genuine pathways and practice models to lead us through. We're about to launch a document called Connection and Community, Transformative Lived Expertise-Led Approaches. This document will guide lived experience-led practice in a new way. It is unapologetically radical while being completely centred in humanness. That shouldn't be radical, but it is. It grounds practice around issues of justice and system transformation to acknowledge that whenever you're doing lived experience-led work, that is the work that you're doing. It prompts a practice model that connects to identity, relationships and community, that's grounded in mutuality and agency and lived experience leadership and connection. We think with this kind of practice model, we can give lived experience workers in lived experience-led services genuine green lights to do the work that they know how to do and to be held in that. We've also developed some systems around lived experience governance, drawing very much from the work of the National Lived Experience Governance Framework that was launched last year. And we've engaged Larsen in partnership for this project to help guide us through, as they were so pivotal in the development of that work. A lived experience governance framework needs to hold all the aspects that typically other governance models do, but do it through a lived experience lens. Through principles such as responsibility to, not over. Through principles such as do no harm. And when we say do no harm, we centre the person in that idea of doing no harm, rather than concerns around risk to practitioners and organisations. We're yet to see how it will all work, but we're really excited to develop this work more, bring it to life and see how it can shape lived experience-led services. So what do we need to do to bring this to life? There's a couple of points here that I'm going to pop up, but I'm not really going to speak to them, because what I really wanted to say is that when we think about doing this, as I said, it's both idealistic and logical. It's grounded in the principles of the consumer movement and the family and carer movement. It's grounded in issues of rights and justice. It seeks to counter a biomedical model that has too often been harmful and at best has been too little in terms of alternatives and options for people. It connects us to the socio-cultural, political experiences of people's lives. These are not separate to our mental health. They are intertwined with it. And it also provides an opportunity, a pathway and permission to centre love, compassion and connection. I'm going to finish today with a poem written by one of the design team, consumer design team for the Healing Place, who with their permission has allowed us to share this poem. Their name is Possum Life. And their vision for the Healing Place, the lived experience residential service, is this: a place without bars on the windows, no obstacle course at the door, furniture not bolted down, a place with personality, to be, to heal, to grow, a chance at getting things manageable, a team that works with you, no forced options, no arguing for basic rights, a real chance at getting better. Thank you.
It's always wonderful to chat with you. You and I could yarn for a while, I know. I'm open out to the floor because there's really a lot of great work that Mind's been doing in the lived experience space, and I know for One Door Mind we've come together with this real frame around this is our history, it's our legacy, is people, carers and consumers coming together to shape, what needs to be there for the future. What can we do to get more evidence around the lived experience models and trying to, knock on the door of funders to say, hey, we need to do this with this lens, and how do we get that, do you think?
Well, if anyone can answer that, let me know, because we are trying. And I guess the key thing is we do actually, there's probably a couple of things. So firstly, we do need investment, but we don't need heaps of investment. We're not asking for the levels of investment we see within clinical mental health services. We're asking for some money towards proof of concept, which allows us to test and trial these types of models and actually see what works and what doesn't, and build an evidence base and build a workforce that can be authorised. So that's kind of the practicalities. I guess the other thing I would say is we need courage, because I've had many moments in the development of these pieces of work thinking, oh God, can we do this? How's this going to work? What happens if something goes wrong? All those very human thoughts that come through. So we actually have to really collectively hold courage, and we have to do this work as a collective. So it's as important that it's led by lived experience as the allyship of those either who don't work from the lived experience perspective, have a lived experience or don't, and can be part of a collaborative approach and partnership approach for this work.
Absolutely. You've had one question, Leslie, but I'll come back to you. Over here. Thank you, Simone.
First question, where do I sign up?
I've got your number, Simone.
Yeah.
Go for it. Sorry, your question.
The question is, do you think the rest of the systems that have been in place for generations are going to have an identity crisis out of this? And how do you counsel that identity, that business, the business identity in private and government business identity crisis? You have answered, open the door. You have answered my business identity crisis, because me, as a person with lived experience, opening private practice, do I disclose? Do I be cautious? This is like, no, it's an identity slogan, but the rest of the spin-off, everyone else is going to have some identity crisis. Question or not question, thank you. You've unravelled the business identity crisis that I'm going through with my lived experience private practice. Thank you.
Thank you. Look, it's not for me to comment on other parts of the organisation's identity crisis, although I do support a regular identity crisis. I think it's very transformative and helpful. But look, in seriousness though, yes and no. I mean, we definitely experience pushback from systems and positions of power. But in saying that, the Healing Place work, we're doing that in partnership with Alfred Mental and Addiction Health, and they're a big clinical service down in Melbourne, and they have been incredible allies in this process. They have opened doors for us into places such as the Office of the Chief Psychiatrist and Clinical Advisory Hub within the department, and then sit with us in that without taking over. I'm not sure that anything that we're proposing isn't what everybody wants. I think that there's a collective understanding that the system is broken, and there's a frustration within clinical spaces about not having time or investment to do their work in the way that they want to do it. So that's certainly been reflected back to us. It's why I say it's both radical and logical, because it really is about centering people and connection and being open to what human experience is. When I talk about authorised, what I'm talking about is we have a peer workforce that's very often been told they don't make decisions, not about the stuff that matters. You know, so when I talk about authorisation, what I'm saying is that I want to see a workforce in these services that feel entirely authorised to hold what we would call high levels of risk in a different way, and hold spaces for, you know, the experiences I had. But I would have loved someone to sit alongside me in that and not to panic and leave me to work through that. But they need to feel authorised to do that, and they need systems and structures around them that protect them and that authorisation, so that those decisions can be held collectively with collective responsibility.
Thanks. Question here, and then we'll go up the back.
Is that working? Oh,
Yep.
Katie, I was wondering if any of the team were looking to any other sectors who are doing this better than us in mental health. You mentioned the addiction space with your relationship, and I know drug and alcohol have some work in this, but any other sectors that you guys were looking to benchmark or learn from?
Yeah, well, I guess the question that it's really opened up recently in this work, as we've been talking about, is what we're proposing here is not really health. It's not really a health response. It's a community connection response. So in the AOD space, we work closely with some folks in the AOD space. We're like, we've been doing this for decades, you know, and they have. And some mental health spaces, that has been true, but it's off to the side. It's not authorised. So I think we have a particular challenge with the way that health funding occurs, but also how we bring mental health into health, so that it's seen as diagnosis, treatment, symptom management, rather than exploration of human experience, which can be so profound. Not for everyone, and some people will want to access that health kind of approach, which is fine, but we just need alternatives. And I think there's some work happening in the family violence space. There's a little bit in the kind of homelessness space, but I'd say AOD is probably the space that we're aware of that really are able to push these boundaries and have been for some time.
Thank you.
Hi everyone, I'm Leanne from Wellways Australia. My question is around, so I'm working as a service manager who manages a peer or lived experience workforce. Something that we've observed, certainly in terms of the way peer work can be developed in, say, public mental health systems, as it is still sort of an emerging discipline and practice, is the importance of the support, appropriate support for the lived experience and peer staff working in identified roles. So I guess my question is there any move towards additional research into how businesses, organisations, public mental health systems can be safely incorporating peer workforces, because they do bring so much evidence-based value? But if you get it wrong in terms of not providing people with support, when at the very core of what they are doing every day is they are sharing safely aspects of their own lived and living experience, and also working with people who are potentially opening up for the first time. So yeah, what work is being done, I guess, to bring everyone along to ensure that psychological safety and sustainability for the peer workforce? Thank you.
Gee, that's a small question.
It is a small question, but it's like really important question.
It's a great question. Thank
I
you.
guess there's a couple of ways I'd respond to that. Firstly, the National Lived Experience Workforce Guidelines are work that provides ways to do that. We know that things that help and are necessary are co-reflection spaces, like discipline-specific supervision. So I lead a lived experience division at Mind, and so we just sit in this space all the time. And the safety that offers for us to bring different parts of ourselves and speak to truth is really different from my fellow lived experience workers working in different environments. I think there's an opportunity to not see it as the work of lived experience staff to do that. I think we need to do really strong cultural change work to understand exactly what the work is, so that we're not constantly having to explain why we're important and why we exist, because that gets a little tiring. We did 18 months of cultural change work at Mind with Dr. Louise Byrne before an executive role was developed, and I think that was foundational in me stepping into that role and not having to explain to everyone why I was there and why I was had an equal opportunity to be at the table. So it's kind of like any movement, it starts to get traction when you get allyship. And, you know, I sometimes refer to the example of the marriage equality campaign, which was so taxing on LGBTIQ plus communities. And the only reason it got through is because everyone stepped in. So in this space, everyone needs to step in. We need to share the load and understand that we're not talking about us and them. We're talking about new ways to support people in mental health crisis and distress that actually are for the better of everyone if we can do it right. So I think it's really that sharing of the load and educating, and yeah.
On that note, thank you very much. Please give a round of applause.